Hi Gary, the atmosphere here in London Road is electric. Not least because Posh's new record signing, Darren Scott, is playing tonight. Well, if ever there was a moment to impress, this is it. This is going to be a hell of a game, Gary. Still nil. That's a good long ball through from Alcock to Darren Scott. Darren Scott goes past the last defender. Still Scott. Scott turns inside the box and shoots. Something's happened. Darren Scott is down in the 6-yard box and he's not moving. The physio is coming on now and he's calling it straight away for the stretcher.
Keep calm, that's fine.
Advice or something like that. Thank you very much. So it's really important to mix the sample well before we put it on the analyzer.
Okay, why is that?
It's because during transit, the cells can settle in sediment at the bottom, and so we need to make sure that it's well mixed before it gets onto the analyzer for an accurate reading.
Right.
So the machine uses a tiny sample to analyze the results. So the machine is currently analyzing the sample and looking at the number, the size, the shape and the content of the cells. The results will then be fed into a computer and the computer will produce an easily readable report. This is worrying. The patient's pancytopenic.
What's that mean?
Well, it means that all their blood cell counts are a bit on the low side. It means that the patient's severely anemic. They need to do a blood draw to look at it further.
Hi, what's up?
Let me take a look at this, please.
It's very anemic. And his white cell count and platelets are down as well. And he's only 23.
Yes, and this is his blood film.
Oh, let's have a look. I think he has acute leukemia actually. There are blasts. Have a look.
Yes, I think you're right. This is Sam, we're experienced student who wants to be a biomedical scientist.
All right, okay, good. Have a look.
I'll leave Sam with you and get back to the lab if that's okay?
Okay, so I will give the results to the medics.
Fine.
Okay, thanks.
Thanks.
Sam, I think the best thing would be for you to have a look at normal blood film so that you'll be able to appreciate the difference. Have a look. Okay. So this is the normal film. Now you can see the red blobs, and they are the red cells. And can you see the purple larger ones? And they are the white cells. And there are tiny purple particles.
Yes.
They are the platelets that help the blood to clot. Okay, now I'll show you the other film. we'll see there are much less the red cells first, and hardly any white cells or platelets. Now, have a look at this cell.
Yeah, it's a lot bigger.
That's right. That's a leukemic cell. I think I would suggest you follow this patient. You will learn a lot, okay? What pathologists actually do behind the scene.
Okay.
You learn a lot.
No, thank you. No, that'd be great. Thank you.
Let me give the results now, okay?
Okay, sure.
Hi, Dr. Brown. It's Dr. Kumar here. It's about your patient, Darren Scott. I have some results for you. He's very pancytopenic and there are occasional blasts.
Blood transfusion is a life-saving procedure, but if it's not done correctly, it can be fatal. So within the blood transfusion lab, we have to be very careful to make sure that samples coming into the lab are labelled correctly. The AutoView Innover has revolutionised the way we work in the laboratory. Although people were very skilled, they were prone to human error.
Of course, yeah.
And the time scale was very different. It could take us up to 2 hours to prepare blood for somebody. The Innover will do a sample in about 45 minutes.
And how many samples can the machine do in a day?
We use it for about 120, 130 samples a day. It would be capable of doing far more. Oh, right, thank you very much. Oh, this must be the anaemic lad that we... Darren, that's the one, yes. First of all, we'll need to find out what his blood group is, so I'll put it onto the machine. Then we need to check whether he's got any antibodies that might cause a reaction with the blood that we're going to give him. We've done all the testing, we've selected the blood, now we're going to issue it to Darren.
Brilliant. Hi Darren, how are you feeling?
Yeah. Okay, thanks.
Oh, good, good. Dr. Brown would have told you what's happening.
Yeah, he said I'm anemic.
That's correct. You are very anemic. And it's not just that, your other blood cells are also down, and that's why you are bleeding. Okay? Now, we need to find out what's causing all these problems. And the best way to find out is by doing a bone marrow biopsy.
Wait, what's a bone marrow?
So bone marrow is the stuff that is inside bone and produces blood cells. What I'm going to do is I'm going to take a small sample of your bone marrow from your hip bone and examine under a microscope.
Is it serious?
That depends on the cause of this problem. So I should be able to answer your question once we have more information.
When will you get the results?
Some of the results should be available within a day or two. Okay? Darryl, I'm going to clean your skin now, okay? It's a bit cold. Okay, I'm going to give the local anesthetic injection. You'll feel the injection going in, okay?
1% lidocaine injection, 05/2013.
Thank you. Ready? Yeah. Okay. It's fine once it starts to work, okay? Now I'm going to do the test now, alright?
Yeah.
Good, very good. Now I'm going to do it now. Just tell me if it is painful, okay? Right, I'm going to suck the bone marrow and you will feel a sharp sensation now, okay? Okay, you're going to have a, yes, right, this is the worst bit.
This is the bone marrow sample from Darren Scott. What we need to do is cut some thin sections like you can see here so we can look at it under the microscope.
So the first problem is it's very hard because it's bone. So bones full of calcium, same as your teeth. So what we're aiming to get to is a glass slide.
The section should ideally be of single cell thickness so the cells aren't overlapping.
The first thing we need to do is get rid of all the calcium out of that. So what we have is this decalcifying fluid. It's a special solution, and what it does is if you put the bone marrow in there for 2 to 3 hours, it will remove the calcium from
just
the
the
tissue.
calcium?
Just the calcium. It won't do any harm to the tissue.
Once it is decalcified, it is immersed in wax to harden it so that we can cut it.
Once it is embedded into wax, then it will be sliced into thin sections with this machine called a microtome. The sections will now be transferred onto water and then placed onto a glass slide. Now we will stain the section. First we will do the standard stain called a hematoxin luminescent. The slides are now coming through. They will be covered with a cover slip which will help to be protected. Now it is ready for a histopathologist to examine. Let's go and give it to a consultant to look at.
When we look at tissue biopsies, we look at a number of things. We look to see how many cells are present, whether they're present in the right places and in the right number, whether they look normal or not, and whether there are any other abnormal cells present, like cancer cells or leukemia. This is a biopsy of normal bone marrow, and you can see that the blood-forming cells are present in the right places here, they're in the right number, and they look quite normal. Let's just look at Darren's biopsy now.
Oh wow, that's completely different. It's really crowded.
Yes, very good, you're right. What we need to do is work out what these cells are, and the only way to do that is to really look at them very closely like this. And we look to see the size, the shape, the staining characteristics of each of the individual cells, and also what's actually inside the cells. These cells look like acute leukemia cells to me, not other types of cancer.
Is there a difference between leukemia and cancer?
Yes, there is. There is, and there are even different types of leukemia. Different types are treated in different ways, so it's essential that we get the specific diagnosis right.
That's blood cancer, isn't it?
Yes, it is a form of blood cancer, but Darren, it is treatable, okay? With our current treatment, we can cure about 50 to 60% of patients with this condition.
What's the treatment?
The treatment is what we call chemotherapy. Basically, it means it is a combination of drugs, some tablets and some injections.
When the treatment's done, after that, will I be able to go back to playing football?
If your disease is in remission and we have managed to get rid of the disease, then yes, you should be able to go back to what you were doing before. That's what I would expect. Darren, we are planning to start the treatment today. Okay, sooner we start, the better. Can you check biochemistry profile, please?
Yes.
And I'll come back with later and we'll go through this again in a bit more detail. Okay? So I will see you a bit later. All right?
When we're asked to do a biochemistry profile, what we're looking for is to check that the kidneys, liver and all the other organs are functioning normally. Right, in order to do this, it can involve doing up to 20 tests per sample, which is basically per patient.
Right.
And often we have to do up to 2,500 tests a day.
2,500 a day.
So as you can tell, that would be really difficult to do manually.
Yeah.
But we do have a solution, and this is this machine. It uses the most up-to-date and advanced technology to process all our samples for us.
Wow.
This deals with all the samples before they actually go into the analyzer. They're spun in the centrifuges, they're then decapped and come through to the aliquotter. The aliquotter separates the samples into samples that are required to go to different laboratories for further testing, or for other analyzers within this laboratory. Let's put Darren's sample through the machine. This is not good. As you can see, the kidney and liver functions are both abnormal. The potassium is extremely low and the liver enzymes are very high.
And what does that mean? Could that be fake?
It could be. What we need to do is bring the results through to the doctors and let them treat the patients urgently.
Dr. Kumar, Marrow's temperature's gone up to 40.
Okay, I'm going to brush your tummy. I think he has got inflammation of his gut and the infection has gone into his blood. Blood cultures, 8 hourly bags, tests in and the metronoidus or fluid balance chart. And I'll be back, okay? I'll come back and I'll be
Like that, and just outside. Okay?
Darren, calm down. Shh.
This is our blood culture analyzer. If a patient comes into hospital and they're very ill and they're suspecting they might have bacteria in the blood, the medics will take some blood and put them into blood culture bottles. And they'll put about 5 mils into each bottle, and then we'll get them and we'll load them onto this analyzer. This is like an incubator, it's done at body temperature. And as you can see, we've got some blood culture bottles in there already.
Patient's blood now?
Yes, they're actually patient's blood. And we'll load them in, and there's a little flickering red light in there. And that's actually a sensor which is measuring the colour of the pellet on the bottom of the bottles. Okay. As bacteria grow, they produce carbon dioxide and they change the pH in the bottom of the bottle. So what you've got there is a nice yellow colour.
More acidic or more alkaline?
That's more acidic.
Okay, right.
So they've actually done that. And because bacteria take about 20 minutes to reproduce, you can get a good reaction in about 4 hours on this machine. Right. These are the plates from Darren Scott's blood culture that we did yesterday. As you can see, we've got plates here which identify as an Escherichia coli. And these are the antibiotic plates that we've done. So basically we've got organism all over the plate, and then we've put different antibiotics on. And where the antibiotics sort of seeping out, the organism, when it gets too weak, the organism will be able to grow up to that edge. So that's why you're getting these zones around. So this plate's showing it to be really quite resistant. The antibiotics there you wouldn't really be able to use.
Okay.
No, these you wouldn't use at all, and these are very small zones, so they would not work in the body.
So you wouldn't use those antibiotics?
No. This one, however, has one really good antibiotic there, the meropenem, and that would actually be good to use on the patient. These again are a little reduced, so we wouldn't be able to use those.
Okay, is that the only one that you could use out of all of them?
That would be the only one recommended, yeah. So what we'll do now is we'll ring the microbiology consultant and let him know.
Yeah, okay, thank you. I'll let the registrar know. Thank you, bye. Caroline, Mr. Errol. I've just taken the results from the lab. Darren Scott. has got coliform sensitive to meropenem.
Oh, no
They want
worries.
his antibiotics changing.
Yeah, no problem.
That's his father.
Lovely. I'll stop us all down this EV.
Okay.
Write him up for a gram of meropenem. We should give him a step dose now.
Yeah, no
And
problem.
then it's 6 hourly after that.
Okay.
Is that all right?
Yeah, absolutely.
Lovely. Thanks very much.
Lovely. Thanks a lot.
Hi, Darren. How are you today?
I'm good, Doc. I'm fit, I'm fresh, I'm ready to go. I want to get out there, play some football.
Oh, very good, very good. Yeah, temperature's down, it's nice. It's been down for about 3 days. So we can stop the antibiotics. Good. Now, Darren, I have got some news for you, good news. You know the bone marrow biopsy I did a few days ago? And it confirms that you are in remission. There's no leukemia in the bone marrow. Okay? So it's an excellent news. Well done.
Dr. Kumar, I was telling Kylie the other day, since I've been here, you've everything that you've done for me, then I thank you very much.
Thank you, Darren. But I must tell you, it was teamwork. Lots of people were working for you behind the scene, okay? Especially the guys in the pathology, so you should really thank them. But anyway, I'm very pleased for you too, okay? Now, we can send Darren home today, but I will see him in the clinic in 2 weeks' time, so if you could make an appointment, please. Okay? So, well done. Excellent. Okay, I'll see you in 2 weeks, sir. All right? See you next week. Hi, Sam. What's up?
What's my last day? I thought I'd better come and say goodbye and thank you.
I see, right. I hope you have learned some pathology.
Oh yeah, I've learned so much. I had no idea how much pathologists did behind the scenes to diagnose and treat patients. I wonder what medics would do without pathologists. I've decided I want to be a biomedical scientist.
That's very good. Good luck.
Thank you.
Sam, keep in touch with us. You never know, you may come back as a biomedical scientist here.
Hope so.
Okay, take care.
Thank you.
Okay, cheers.
Cheers.
Bye.
Darren Scott takes the ball on the edge of the box, turns, tees up his shot, here's a chance, he shoots! I can't believe this, what a goal! Darren Scott has scored his first goal for his club. It's taken 1 year for this courageous young man. The Posh fans are going wild. This is fantastic. 6 months after finishing chemotherapy for a life-threatening blood cancer. I'm sorry this is too much for me. Never mind Pele, never mind Beckham. Darren Scott has scored the ultimate goal.